So welcome to this edition of Brain Talks. It is a podcast series under the Brain Innovation Days umbrella. The Brain Innovation Days brings together key stakeholders in the brain innovation ecosystem. And this really with the aim to create synergies, but also to showcase the importance of brain innovation and how it is changing Europe. In this Brain Talk, we look ahead to the next Brain Innovation Days digital session of January 2021, which is focused on creative brain interventions. The session will not only host a pitch competition, but also a panel discussion with key players in the field and with focus on the startups. As the panel will be an interactive discussion, each startup will have their own podcast to introduce their company, their work, and their stories. So today we're glad to welcome Ludovic Ampe from Belgium, co-founder of Helpilepsy, the digital assistant for people with epilepsy and their neurologist. So welcome, Ludovic. Happy to have you here. So let's start right away. Can you tell us a bit more about how you started with Helpilepsy and maybe a bit more about your background?
Thank you, Elke, for the invitation, and thanks for the talk. We all started back in 2015. The brother of one of the co-founders has epilepsy, and we saw that currently in the epilepsy care, there are a lot of challenges, both from patient side as from medical team side. With our digital background, we decided to join a hackathon organized by UCB to really try to find solutions to improve epilepsy care today.
Okay, so what is Helpilepsy exactly? I already shortly introduced it, but can you tell us a bit more about what it exactly does and how it helps patients and their neurologists?
Today, patients, they see their neurologists 20 minutes every 6 months. In between two appointments, 1/3 of the patients still has epilepsy seizures, 1/3 of them are also treated for depression, and quite a lot of them have heavy side effects because of the medication. The only help they have today between the appointments is a paper calendar. So the neurologist is proposing a paper calendar to patients to track their treatments, to track their seizures, and to track their side effects. For the neurologist, he also sees his patients 20 minutes every 6 months and has to take very heavy therapeutic decisions based on the memory of the patient or a piece of paper. So we thought, how can we improve this? And so what Helpilepsy is, it's a combination of a smartphone application for the patient to better track, understand, and self-manage the epilepsy, combined with a dashboard for the physician where he has a very clear overview of the evolution of his patients.
Okay, so both the patient and the clinician is a user. Is the pharma also playing a role? Because I was reading that as well.
Yes, so we initially started to improve the epilepsy care in a clinical practice. So the normal routine between a patient and a clinician. When we developed a platform, pharmaceutical companies, they came to us if they could use our platform in clinical research. A lot in clinical research is also done on paper. A lot of questionnaires are done on paper. A lot of data gathering is done on paper. So they were wondering if they could use digital tools to have better data in clinical research. And so that's why we developed the clinical research part of our platform. And what it actually is, it's an extra module for the patient. So the normal Helpilepsy application for patient consists of 4 pages. If a patient would participate in a study, we will add a 5th page with information about the study, with the option to answer questionnaires of the study, and with contact details of the study. What it is for the clinical team, the study setting, it is a separate page where next to the overview of their patients, they can also have an overview of their studies with the main study documents, and they can see all the answers of the patients for the study questionnaires.
Okay, so this was the first solution. Now you also have a second product, let's say, which is a solution in the disease area of migraine. How did you came about the Migraine Manager, which is the name of the second solution?
Quite some neurologists that were using Helpilepsy, they asked us if we could develop a similar tool in migraine, because we do see that what we developed in epilepsy is actually also useful in other disease areas, because today the care of chronic disorders is really suboptimal. And we really believe that with technology, we can truly empower patients, not only in epilepsy, but also in other disorders, and also give the tool to physicians to have better care for their patients. So concretely, neurologists, they came to us and they asked if we could develop the same for migraine patients. So on their demand, so on the demand of the market, we developed Migraine Manager.
Okay, so how exactly is it then linked to Helpilepsy? Are these two separate products, or does it then all come together?
It all comes together in one platform. And so the platform consists, first of all, of smartphone application for patients. So that is Helpilepsy for epilepsy patients and Migraine Manager for migraine patients. But this comes together in one dashboard for the neurologist. So on one account, in one dashboard, the neurologist can follow up epilepsy patients and migraine patients.
Okay, so you have two products now. Are there any other products in the pipeline in, let's say, the near or far future? And are you focusing on other disease areas as well?
Yeah. So we'll stay in neurology. Our goal is to become global leader in neurology. Just for the main reason that we focus everything around the neurologist. So we want to build the platform for neurologists where he can follow up all his chronic neurological patients and all his studies. And so that's why our pipeline is neurology only. And indeed, we are currently doing discovery on 4 or 5 pathologies like multiple sclerosis, Parkinson, stroke, Alzheimer, and we will launch the 3rd application next year.
Okay, exciting. So with this platform, there's actually, let's say, also a big focus on data and data aggregation, but also then, I guess, using these data for data-driven insights. Can you tell us a bit more about that and the vision behind this?
Currently, we're working on data gathering, data visualization, self-management. And indeed, in the future, we want to leverage that data. And so concretely, what we could do on patient side, we could give them insights based on their data. For instance, on epilepsy, we could one day tell to a patient, dear patient, you only slept for 4 hours. Based on your history, we saw that there is a correlation between sleep and epilepsy seizures. Maybe you should be careful today in what you do. So that's on the patient side. So really giving personalized advice based on their data. For physicians, what we could do is, based on data of all their patients, we could propose certain therapies, or we could compare certain patient population.
Okay, interesting. So you're really going towards the platform and the data aggregation. Something else, actually, because Helpilepsy is since 2019 marked as an official medical CE device CE class 1, and more recently you also are ISO certified. I believe that's let's say a long journey. Was it a tough journey, or how did that go?
We decided from day one to become a medical device. You can choose really to become non-medical, but from day one we want to become a medical device with medical proof because we want to go towards reimbursement. The CE certification, we are currently a class 1 device, which is self-certification. So in terms of effort with the right consultants, that is manageable. A tougher one was the ISO 13485, which is a certification for our quality management system. And that is impacting the whole organization. And so this results actually that we currently have a full-time quality and regulatory person in-house, to manage the system and to further update or upgrade our company towards all the new regulations.
Okay, so but it was, let's say, a clear objective in the beginning to go for this and to have this certification. But actually, in the end, it was okay if you have the right people, let's say, to do this process.
It's indeed, I think a lot is about the right people, and indeed, from our perspective, we really wanted to become this medical company. But next to that, we need to have a couple of certificates enabled to be a vendor for clinical studies for pharmaceutical companies.
Okay. And actually, the certification probably also played a big role in the internationalization, let's say, in Europe. You had a focus on that quite early on. Can you tell us a bit more why and how that went?
The epilepsy market is quite small. Even if it's 1% of the population, there's only a limited part of neurologists that do see a lot of epilepsy patients. And to give you a little bit of an idea, in Belgium, we're speaking about around 50 neurologists that see a lot of epilepsy patients. So that means that our market in Belgium is actually really small, only in epilepsy. And that's one of the reasons why we also are in other pathologies. But if you focus on epilepsy, let's say there are 50 neurologists in Belgium. So it's quite a natural reflex to go abroad just because our market in Belgium was so small. Next to that, we see that the challenges we try to solve in Belgium, so lack of data, not a good communication between patient and physician, we see those same challenges in the other countries. So we do have the product, we do solve problems, and so we're happy to do that in other countries as well.
Okay. So in this, let's say, internationalization journey, how important are strategic partnerships?
Yeah. Strategic partnerships are very important, and we were lucky to have UCB as a partner from the beginning because we won their hackathon, and that was the start of our company, and they have been supportive throughout the journey. So strategic partnerships are really important. First of all, to kick off your company, to have some first clients, and next to that, indeed. Very large companies, they can give you access to international markets. And so that's why we launch always together with UCB in the other markets in Europe.
Mm-hmm. Are you planning on having strategic partnerships with other companies, not necessarily only pharmaceutical companies, for example?
Yeah. We do plan partnerships with other companies like medical device companies. Our vision is to create the ecosystem in neurology. And so we cannot build the ecosystem alone. Our strength is software and data. So we hope to integrate or to connect with external devices. So that means currently we are already connected with a hardware that can detect epilepsy seizures. That's a Dutch company called Livershirt, and their device Nightwatch is connected to our system. So yes, we are looking for strategic partnerships, especially in hardware, to improve our solutions.
Okay, and then it all comes together again in the platform that you're continuously building, right?
Yes, exactly. So the data we capture from external sensors, external devices, they are indeed visualized in our platform. We can use them for further research, and they are indeed visualized both for patients as for physicians.
Okay. So we were talking about, let's say, the European internationalization. Did you ever consider to go to the US or to Asia, and why, if you have decided already?
Yeah. So we currently are active in 10 countries in Europe. We have pilots running in New Zealand, Africa, and Canada. So we truly want to become a global company. And I personally believe that if you really want to be very successful in medtech, one day you should go to the US. The only point there is that it's not a very easy bridge to go to the US. And what we hear from other startups, the US strategy is go hard or go home. And so currently we are exploring some opportunities in the US, but before we really go there, it will be with an extra funding, with a big team to really go all in.
Okay, so you would say we need really the resources, let's say, to go for that. So that would be, let's say, an important aspect to take into account before you really go into another country or into US or Asia. So you were talking about 10 countries and even more. In some of these countries, you're also preparing reimbursement. In which countries do you see actually the largest potential for reimbursement, and why?
So indeed, our long-term goal is indeed to have reimbursement for our products. Reimbursement of digital application is quite new in Europe. A lot of countries are looking into that, but not a lot of countries really do it at the moment. The most promising country at this moment for us is Germany. In Germany, they voted a special law for reimbursement of digital applications. This is quite new because in other countries, they try to use the same rules for medication or for other treatments on digital applications, which is not always very useful for us.
Mm-hmm.
But again, in Germany, they have this special law for application reimbursement, And the first application have been reimbursed in September. So this is for us the most promising country. Belgium is also taking some very good steps in that. They reimbursed the first application already. Some of them are in the running. So we're also definitely looking into Belgium reimbursement.
Okay, and actually maybe a bit linked to this reimbursement, was let's say the whole COVID-19 situation actually a catalyzer for you, or on the contrary, it slowed down? Because you could imagine that it might in some way help to push things, or wasn't there a direct link in your case?
Yeah. COVID-19 definitely accelerated our business in that sense that we can do digital monitoring. So physicians can fully remotely real-time monitor their patients. This really helps to keep a good communication with their patient and to really keep an overview of the situation of their patients. Beside our current solution, we also did a survey with our physicians to ask them how we could further support them during lockdown. And one of the main questions was video consultations. So that's why we launched in April our video consultation solution. So again, in the same platform, in the same dashboard for the neurologist, he can also invite patients to do video consultations. So you can do video consultations and you have the data of your patients that you can use during the video consultation.
Nice. So I imagine, let's say, all of what you're saying, you're not doing totally on your own, I hope, because otherwise it's probably a big job. And I also heard that your team actually grew recently from 2 to 10 people. Can you tell a bit more about that? How the team grew from 2 to 10?
So maybe first, indeed, we're not doing on our own. So we're looking for partners indeed. So for instance, for the video consultation, we use an external partner as a plugin in our platform. We did not develop our own video call tool. We like to not to reinvent the wheel.
Okay.
But indeed, a lot is done internally. So indeed, the team grew quite fast. First of all, we needed a lot of technical expertise in-house. So the first focus was to reinforce the technical part. And the second focus was to make sure that we could follow up with the regulatory and the quality aspect. So that's why we now have a full-time QA/RA manager in-house. And the third part was a marketing and sales team. When we felt confident and the product was good enough to go to the market, we gradually expanded the sales and marketing team.
Okay, and so this is a nice team. Can you tell us a bit more about what you like the most about, let's say, your team?
Yes. So for me, what I most like about the team is that they all believe in our vision. So they all believe that digital therapies, that digital tools can truly have an impact on the quality of life of people. And what really makes me get up out of bed in the morning is to see the passion of the team. So this is truly amazing. And the second part, what I like about the team is the international aspects. We are all very international. English is the number one language in the team. We have people coming from all over the world, so this adds quite some flavor and quite some culture into the discussions.
So let's say even before COVID, you were already very used to the teleworking, I guess, with such an international team.
Yes, correct. Even if the majority of the team is based in Brussels, we do have people working in other countries. So yes, we're already aware of teleworking. But that said, we truly believe that face-to-face interactions are really important, especially in young teams. So we hope to get back soon again.
Okay, all right, that's really nice, and we all hope that, I would say. So maybe now heading a bit to the January event, because that's obviously also why we invited you, because you will be part of the panel in January 26th, where we'll talk about the challenges that, let's say, startups, scale-ups face. So maybe you can already give us an insight into your biggest challenge. Let's start with the best. What was the biggest challenge in the past so far for, let's say, you or your company?
For us, the biggest challenge, let's say, of the last year was the regulatory aspect. We signed one big contract with a pharmaceutical company, and there was a big clause in that contract that if we did not meet regulatory requirements, they could cancel the contract. So it was a very heavy push of the team to get the CE certification and to get the ISO 13485 certification.
Okay, and if we look ahead, would you already have an idea on, let's say, the next biggest challenge? maybe in the near future or a bit further away?
Yeah. I like to refer back there to our discussion on reimbursement. Our long-term business model is reimbursed digital therapeutics. So we see indeed that some countries already take steps towards reimbursement of digital applications, but we hope that a lot of other countries will follow to really be able to have startups that can really have business models based on digital reimbursement.
Okay. So am I correct that obviously in a company like yours, you face these challenges quite often, right? You have big challenges and smaller challenges, but obviously you have many of these. I know that can sometimes be hard, and as you're saying, you have a great motivated team, so that's already nice. But have you ever had like really a very tough moment where you said, "Oh, really, this is now really too much," and how do you then cope with it, and how do you stay sane? If I can ask that.
Yeah, sure. There was one moment that our bank account was going down quite fast, and that the zero was very close. The reason for that was that our funding round took a little bit more time than expected, and I think this was one of the feelings in my life that I would really like not to have anymore, because you do have this responsibility, and it's really not a nice feeling. How did we cope? I think there our biggest strength is that we're currently two co-founders at the company, and it's just by sharing the feelings and by sharing the fear that we get out of this. So the biggest strength here was the team.
Okay. Yeah. So the team, let's say, really helped and helped you cope with that because you're not, let's say, not standing there alone, but everyone is supporting and sharing that feeling. So actually, maybe to close up, can you actually provide us with some tips maybe for other startups, let's say in the healthcare sector in the brain region?
Mhm. For me, the biggest tip, and that's actually from our own experience, we had a lot of very good feedback because UCB was a strategic partner from day one. It does not have to be a pharmaceutical company, but just having one logo on your slide just to start pitching is really important. And people like logos, people like social proof. So just getting one hospital, one pharmaceutical company, one patient organization really helps.
Yeah, yeah, I can definitely imagine that. It also helps for your credibility, I guess.
Exactly. Yes,
Okay,
completely agree.
okay. Is there anything else you'd like to say, Ludovic, before we end to, let's say, the people out there or other startups or your own team?
Uh, Yeah, first of all, I would like to thank our amazing team to really believe in our vision and to really push boundaries. Then second, thank all our partners like hospitals that really believed in our dream from the beginning. And then third, maybe as an advice for all people that are listening here that maybe think to launch their own startup. I think a lot of people now in those times think about impact, what they want to do. I could just say, yes, it's very scary, but sometimes jumping will have a lot of joy afterwards.
Okay, great. Nice words to end. Thank you very much, Ludovic, for this nice conversation and also for giving us a bit insights into your story and the story of Helpilepsy and the other products you're building on. And then also thank you to our listeners, of course, for tuning in. We hope this discussion was really enlightening, and we also hope it already give you a sort of sneak peek into the January session where we'll see Ludovic again. So I would say stay tuned for more details and make sure to follow us on Twitter and LinkedIn, and hope to all see you on the 26th of January 2021. Thank you.